The following program contains extremely graphic images of medical procedures, some involving dead bodies, which may be disturbing to some viewers.
Hello and welcome to Snapshot. I'm your host, Alan Wolffe, and on this edition, we're going to take you for a most exciting look at an exciting field of dentistry, the field of forensic dentistry. Now, I must warn you that on this show, there are going to be some very graphic pictures of crime victims. So if you have any small children or if you are bothered by this kind of thing, please turn off the show now. First order of business, the office of Dr. Richard Souviron here in Coral Gables. Let's go inside and begin our investigation now. Well, this must be the place. Dr. Richard Souviron, good to see you again.
Nice to see you, Alan.
Folks, Dr. Souviron is one of the leading forensic dentists in this area, and he has invited us today to his office, and later on, and don't go away for this part, to the Dade County Medical Examiner's office to investigate the field of forensic dentistry. Now, as we said before, this is a field of dentistry that deals both with a civil aspect and a criminal aspect. And could you perhaps explain to the audience the differences in the forensic dentistry in each of those fields?
Briefly, the area of forensic dentistry dealing with civil has to do with dental injuries that result usually of automobile accidents, but they can be a result of assaults, slip and falls, and this type of thing. So I'm asked many times to treat patients that have injuries resulting from some kind of a trauma. Also, the insurance companies many times will hire me to review injuries that patients have sustained to find out are they legitimate, were they related to the accident, or is it a case of fraud? And so it's an interesting field, and it takes up quite a bit of time.
Well, now, excuse me, when you talk about a case of fraud, if somebody has an injury, I mean, how could that possibly be fraud? It's either going to be a civil situation or a criminal, right?
Well, usually the fraud aspect doesn't get involved in the criminal, although I have had some cases that have been, the state attorneys asked me to evaluate because there was criminal fraud involved, such as defrauding Medicare or Medicaid. That's a fraud.
Is this real widespread?
No, it's not widespread at all.
I guess that makes it harder to detect because it's not an everyday kind of a situation.
Right. But as far as the injuries are concerned, you know, sometimes, even though we'd like to think everybody is honest and truthful, that they're not. And patients will come in sometimes with, or people will be sent in to me to evaluate a quote injury, and it pre-existed the accident. In other words, they were missing teeth from before the accident, or they had a break of a tooth that could not have resulted from that particular accident that they're claiming, but they're suing Sears or Kmart because they fell and they injured something that was already injured.
Have you ever had the occasion to tell them right up front, hey, this didn't happen the way you said it did? Of course, you know, probably with a whole lot more tact than I would use, but...
No, I'd like to do exactly like what you're saying. No, I'm asked to review it and present my findings to the insurance company. I'm not being hired to tell the person what I think about them. So I usually don't make any comment one way or the other. I just get my findings and do my analysis, and then I write a report. So I do confront them, but it's usually at trial in the courtroom.
Oh, I'll bet that's a shocker, isn't it? Come into the dentist's office, you think you've got him under your thumb, and he really knew all along what you were up to. So that would be the civil aspect of this job. Then there's the criminal aspect. Now, which do you generally spend more time on? As far as the amount of cases, I should say.
By far and away, the number of cases are civil. By far, more civil than the criminal. You know, criminal, you really have to be careful how you evaluate that, because if somebody, for instance, in Waco, when all those bodies, 70-some bodies burned up, when that really could be considered criminal, although those people, all of them that died, weren't criminals.
There certainly is a lot of controversy as not only to how the fire started, but lots of aspects there. So
Right.
I guess that's what would perhaps make it unclear as to whether this is a civil situation or maybe there was some
Right.
criminal intent there as well.
I think maybe a better way of putting it would be that I do a lot of work in this office that involves the civil, but it also is done at the medical examiner's office where somebody is dead as a result of, let's just say, an automobile accident or a plane crash.
And of course, we're going there later on to continue
Right.
our investigation.
Right.
The criminal aspect certainly is one that makes the headlines that people always see in the newspaper. I remember the Ted Bundy case, and I know you remember that case too, this mass murderer that finally got his due. Did you have any involvement in that?
Yes, well, Ted Bundy was a serial killer as opposed to a mass murderer. I would say that David Koresh is a mass murderer because he killed everybody in one mass. The serial killer is a better term for what Bundy was. He killed some 50 women over a period of years, systematically, methodically, very concentrated effort, and perfected his skills on killing people. And he did them over a period of time.
Did you ever meet him?
Oh, yeah. I spent a lot of time with him. I guess a lot of time. I mean, it's more time than I wanted to spend with him.
We know that he's a serial killer as opposed to a mass murderer. Of course, I knew that. I was just checking a doctor to see if he knew the difference in terminology. I knew that was a serial killer, of course. But was he a likable guy? I know that's crazy to say, but was he a likable guy in terms of somebody that you just met if you didn't know what he was? Or is that too hard to separate?
No, I don't think so. I think most of the serial killers that I've been involved with are very likable if you don't know anything about them. If you just, and they would not be successful in their trade if they weren't likable. In other words, some young girl isn't going to get in the guy's car if he's not good looking, if he's not glib, if he doesn't have the right words, if there's anything about him that would make somebody nervous, they'll avoid him.
You know, when I was in high school, I was good looking, and they would never get in my car. I didn't have much luck either. But seriously, we do have some very graphic pictures to show you. If you have any small children, any children at all in the room, you might want to ask them to leave. Also, if you tend to get queasy at these kinds of things, as we said at the very outset of the show, perhaps you do want to change channels at this point, because these pictures are just unbelievable. And to start out, perhaps we could start with this stack here. Now, is this in the civil or criminal realm?
All of these these displays of one type or another that you're holding on to, these are all in the civil realm. And what we're looking at here is a cross-section of a cadaver. And this area right here is the temporomandibular joint. We're showing the temporomandibular joint and the disc that operates the joint, and then all the vessels that are in and around the temporomandibular joint, included but not limited to the inner ear, which is what you're looking at here.
Okay.
I don't think this is so bad.
That's because you're a dentist. and the rest of us don't see this as frequently as you do.
This is again, this is a cross-section of a cadaver, showing the area of this is the jaw joint, if you will, and this is the inner aspect of the joint. This is a carotid artery. So it shows the relationship of the jaw joint to the carotid artery.
Why do you need these kind of photos?
These are graphic photos that help explain people that have temporomandibular joint injuries or injuries to their jaw joint, the joint in front of your ear. And many times they have very severe headaches as a result of that. And if you've got your carotid artery in direct proximation to the temporomandibular joint, you don't have to be a mental giant to figure out that an injury here could be related to problems in the carotid artery, which in turn is going to give them headaches.
Yeah, I wonder if that mental giant was like directed toward me, or lack thereof. Okay, this is obviously a drawing.
Yeah, this is a drawing, and this has a acetate on it, which I can draw on the acetate to the jury to show them and then flip it out of the way. But what you're looking at here is an impacted wisdom tooth. And we're showing the jury where all the nerves, the yellow things represent the nerves, and how a wisdom tooth laying on a major nerve going through the jawbone, when it's removed, you can get a severance or breakage of that nerve, which is going to lead to the next picture, which shows numbness at, I think it's the next picture anyway.
That's a good picture.
It can show numbness. Well, this picture is an x-ray of an impacted wisdom tooth here. That's just a partial picture of it. It doesn't show.
I see it's off to an angle a little bit.
Yeah, it's off, but the x-ray, if you're going to remove the wisdom tooth, the x-ray needs to be moved this way so you can see all of the wisdom tooth. And then the next chart is turns this way. This is the area of numbness that an individual is going to experience. The yellow represents where the nerve comes from. This is an overlay, if you will, showing the actual tooth that was removed. Here's the nerve. I don't know if that's showing real well on the camera, but with this nerve is injured with the removal of this tooth, it's going to cause numbness to the area that we just showed. This is a panoramic x-ray showing the...
And what civil significance would this have?
In this particular situation, this individual had the wisdom tooth removed and ended up with a numb lip. So they were suing for dental malpractice as to why, did the extraction tooth cause it, and then if it did cause it, was the dentist that removed it negligent in the way he removed them? Did he inform the individual that they could be numb from this procedure?
I see. So you're sometime an advocate against people who have perhaps committed malpractice in your own profession.
That's
an uncomfortable position, perhaps.
It is uncomfortable, and I don't know that I'm an advocate either way, because I certainly have
when you're hired, is that correct, as a witness?
Sure. Yeah. I'm hired to review the case and give an opinion to an attorney or to an insurance company.
So you're an advocate by virtue of telling the truth?
Yeah, I think so. That's a good way of putting it. Again, this is a drawing showing the inside of the mouth, and in this particular case, we're showing where the tongue lies in relationship to a tooth that was removed. This is another schematic drawing showing where upper teeth, how they lie close to the sinuses here, so you can have injuries to your sinuses from the removal of upper teeth. This is again a drawing. This drawing shows what's referred to as the lingual nerve or the tongue nerve, and that also can be injured, and a person can end up with a permanently numb tongue.
Well, I'll tell you, sometime I wished when my children were growing up they would have had a permanently numb tongue.
Yeah. What about my wife?
Don't worry, we'll edit that part out.
Yeah, edit that out.
Sure.
But anyway, what this is an interesting picture. This is a slide that has been enlarged via computer to try and enhance. Usually, you lose a lot of sharpness or definition when you enlarge a little slide. If we can show this, if you take a slide this size, and this, in order to show this.
This is this.
Well, if you take a slide that size and you enlarge it, you're going to lose a tremendous amount of definition. And this, if we can pull this paper off of here, it will show better for the camera, because this tends to block the light. Get that off on your side, Alan. There you go. Now this is going to show, what we're showing here is this ledge at the gum line area, and the reason that ledge is there is when some bonding was removed from this tooth, it was taken off very quickly. It was taken off in a less than a judicial manner, and a big ledge is left down here at the gum line, and this person is going to have 6 of their teeth capped.
And this is a result of somebody doing improper work?
Yeah, I think so.
Okay. Well,
wasn't
now,
like that before.
Now to the criminal aspect, and I got to tell you, these are rough and rugged pictures. So again, if you didn't think some of those were rough, these are tough pictures, folks. So you might want to consider turning to another station, but this is something else. What do we have here?
What we have here, in fact, this one and the next one, this is an individual that was a parachutist and didn't make it. This occurred in '91, and this particular individual plummeted from some 7,500 feet to his death.
Wow. And our next one here, I don't even know which side's up on this.
Well, that's this is another parachutist, and this area right here is the face, and
there's the hair on top. I see.
Yeah, that's the hair. There's some teeth in the photograph, and the purpose that we're showing here is that identification of this body and the previous body can only be made through either dental or fingerprints. Dental means can be done very rapidly and are extremely accurate for identification.
Okay. And of course we have a.
Well, I don't know if you want to show
article.
this one or not.
No, I think we'll leave this one for another time because we do have lots of other stuff to.
You may not want to show that one either. You may want to block off part of it.
Yeah, I think we will block off part of that so our editors don't have to do overtime.
Crazy. Basically, what we're looking at here, this is down below. Jim Buchanan wrote this article about an individual that. We see this in the criminal justice system a lot. He'd been convicted of numerous rape cases and was paroled and then went back and did it again. He was sentenced to 10 years, was out on the street 6 months, and then he raped somebody again. He never did 10 years, did maybe 18 months of a 10-year sentence. Let him out, and then he attacked a woman. In that particular case, the judge decided he wasn't going to get out again, so gave him 135 years.
Yeah, well, you always wonder just how much of that actually will be served.
Of the 135, I can tell you, it says in the article, and I know the judge involved, it's John Gordon, and he means business. And this guy, it cannot get paroled until the year 2025. So if that tells you anything.
Well, at least that's something.
Yeah. What you're looking at here is a bite mark that was left by Ted Bundy in the Chi Omega killings in Tallahassee, in which one of the co-eds was bitten. And this shows the mark left by his teeth. He bit twice. This is the first bite mark, and then he came in at a different angle this direction and left this mark. And these marks here were left by chips or cracks on his upper teeth. He had jagged teeth, and it left these scrape marks which matched up to his teeth. This is another bite mark case, and all this photograph depicts is the teeth of the attacker, models of the teeth of the attacker that I took, matching to a life-size photograph of the actual bite mark. And then when you put the teeth over the photograph, and you can see how the eye tooth made this mark, and then there's a gap with these three teeth in line. Here are the marks of those three teeth, and here's the eye tooth. And this is done one-to-one, and then we enlarge it so that it's easier for the jury to see.
Now, this is required in addition to your testimony, these photos.
Anything that you can do to educate the jury. An educated jury is a good jury. So my philosophy is that they be educated to the point to where they can actually take the model themselves, the actual model, this model, with the one-to-one photograph and put them together in the jury room.
Understand.
This was you've already seen that one. This last case is an interesting case. This was the biting bandit in Homestead that occurred back in a couple of years ago, where he was biting off ears and fingers. He didn't kill anybody, but one of his, without going into a 30-minute dissertation about the case, because it was written up in Tropic and was very well written up, but the police department had a suspect in jail for these biting and robbery attempts, but they had the wrong guy. And another victim was bitten while the suspect was incarcerated. All of a sudden, somebody else, and they wanted to see if I could tell them anything about what this person looked like. And the interesting part here is this was a victim that was brought to my home, and the detectives asked me, "What can you tell me about the attacker?" And this is a bite on the shoulder. He had 3 bites, one in the neck, one on the shoulder, and one on the arm. This bite right here is left by lower teeth. And if you go around here, there's something here that's pretty obvious, I think, to everybody.
There's something missing.
There's a missing lower tooth. So their suspect is missing a lower tooth. a little more sophisticated in the upper jaw, but these are the upper teeth, and I told them that he's either going to have a break or a crack in a tooth because there's a little tiny gap in here.
That's very clear there, yes.
Okay, so he's going to have broken or chipped upper teeth, and he's definitely going to be missing a lower front tooth.
What was the bottom line on this case?
Bottom line on this case was that the innocent party that was in jail was released the next day after this information came out. Secondly, they picked up a suspect that was missing a tooth in the lower front part of his mouth. So they got the guy.
So your work not only can put people away, but can protect those who are innocent.
I think so.
Yeah.
It's done. We've done a lot of that. You don't hear about those. You don't hear about.
They're not sensational.
Exactly. You don't hear about the ones that are let go.
Well, that's very interesting, and we are going to continue our investigation into forensic dentistry with Dr. Richard Souviron at the medical examiner's office, and we'll be back right after this. Don't go away. Well, we are in one of the autopsy rooms here at the Dade County Medical Examiner's Office, again with Dr. Richard Souviron, forensic dentist. And I must tell you, there is no way to capture the smell of this place. Do you ever get used to it?
No.
You know, when I was, you'll have to excuse me, it is an incredible scent. When I was reading the literature on what we were about to do, I couldn't identify which one of the bodies in here you were about to work on. Is that frequent?
Yeah, that's why it's very important before you do an autopsy on somebody, or in this particular situation, I'm going to be getting records for dental identification, that you check the body identification. We have the written material that you have in your possession that you've looked at, but then you go to the famous the toe tag, and you go down and you check the tag on this body to make sure that we're dealing with the right body. And they have a tag tied onto the toes, so we've got it. And then I think it's important that you understand what we're doing and why we're doing this. You want to be able to make identification on somebody when they can't be identified visually by the family member. For instance, the 1700 body that you have in the other, on the other table over there that we're going to do is non-viewable. This body is a non-viewable body, basically.
Leo, let's see if we can get a tight shot here on the face of this body. This was found, I understand, in a frozen state aboard ship.
Yes, he, according to the records, and you know as much about it as I do, because I just walked in on it myself, but he evidently was a stowaway from Colombia in a cargo ship, and didn't realize they were going to turn the freezer on in the compartment that he was hiding in. It's kind of like the people that stow away in the wheel wells of airplanes, and at 35,000 feet they freeze to death and there's no air to breathe, so they die.
You know, it almost doesn't look real, but it certainly smells real.
You really like the smell, don't you? I can tell.
Well, it's not a matter of liking, it's a matter of the smell being absolutely overwhelming when you walk anywhere in the building here.
These are clean bodies. These were brought out special for you, because these aren't the bad ones.
Oh, these aren't the bad ones?
These are nothing.
Well, Snapshot certainly brings all of our viewers behind the scenes, going places you probably would never want to go. But here we are, and it is actually quite interesting, despite my voice. My voice is normally not in this state, but every time I take a big breath, I sort of stop halfway in between. Certainly I don't want to be found on the floor in this place, though.
You can say that again. I'm just going to walk through a routine, what we normally do, what I normally do on these. One of the best ways of identifying a body like this is going to be from a smiling photograph, matching his teeth that you can barely see, his front teeth with either a driver's license picture or some family photograph, and you can make a positive ID that way. So it's important that we gather photographic information of the body before we do any work. And we're going to start cutting them apart here in a minute, so you'll see how we get the rest of the dental records. And I'll go ahead and...
Yes, certainly we're going to begin cutting the body apart here in a moment, folks. First step is the photos.
Yeah, I'd usually take a whole series of photographs, and then we have to get, you can feel here that this guy is, at this point, it's like a rock.
Yeah, I think I'll pass on that part of it, but I'll take your word for that.
On it.
Certainly.
So we have to we have to get him to where we can see what we're doing, and part of that is to get the soft tissues out of the way. Are you okay, Alan?
I'm fine. I'm doing just fine at this point. I hope all of you in the audience are doing okay, too.
I think they've turned off the TV at this point.
I'm sure.
Now, if you'd put some gloves on, you could help me with this.
Well, thank you for the offer, doctor, but I think I'll leave this to the professional.
It doesn't take much help to pull this stuff back. This is fortunate for us that it stays back. And then what I like to do is get the teeth cleaned up so that a photograph is going to show up.
Does insurance cover this examination?
No.
Okay.
No. It doesn't even cover my part of the examination, which is what if something happens to me and what if something happens to you while we're down here.
I needed to hear just that. Being in the Dade County Medical Examiner's office, I guess we'd be right here, wouldn't we?
Yeah, well, you'd get a free autopsy.
I reckon. You ever notice on Snapshot everybody wants to be the comedian? I'll do the jokes if you don't mind. No. And we brush the teeth now.
All right. We want to get any debris off of them so that if we get a photograph of this, it'll show up nicely. And we have the case number, this particular case, and we'll put it up where somewhere in the photograph where it will show up. And if you notice, he's got an unusual set of teeth. He's missing 2 side teeth right here on either side.
I noticed that.
Yeah. So the odds of finding 2 people in the world with this situation are pretty remote. So if somebody is missing from Columbia and the dentist sends up that the guy is missing, just these 2 items alone would be enough to match him up. Of course, there's going to be more, but anyway, we'll get a photograph of these teeth. And then from this point, what we're going to do is we have an x-ray unit set up here, and it's one of the few morgues in the United States that have 2 dental x-rays. We have one in this morgue, and we have the main morgue, or the big morgue, also has a dental x-ray. And that's extremely unusual to find one. I would say 75% of the morgues in the United States don't have any dental x-ray facilities at all. This one has 2.
Generally, is this one of the most well-equipped in the country?
This medical examiner's office is the #1 medical examiner's office in the country. We train. Dr. Davis's program trains more residents than any other medical examiner facility in the United States. For the size of the community, there are more autopsies done here than any other place in the country on a per capita basis. Obviously, if they have 1,000 homicides in LA, they put 1,000 more autopsies through, but they're quite a bit larger than Dade County, too. So it's well equipped, it's very, very functional, it's and very well run. Now we'll take the x-rays next, and then I'm finished with his body.
Understand.
And you wanted to talk to me about this other.
We're going to go ahead over here and take a look at what doesn't even look like a body. You'll see this. It's incredible. It just looks like a prop on a movie set. What happened?
Well, you have the papers on it. You can
I certainly
read that
did.
in. But this particular body has been here since, what's the date? 1700, isn't it?
1700.
This body has been here in storage, awaiting identification since somewhere in the middle part of 1990. So we're talking 2 years that this body has been in here. This guy was hit riding a motorcycle on 836. And there's been no identification on him.
So basically, stay away from parachutes, as we saw in your office, and motorcycles. They're dangerous.
Anything's dangerous on 836. So.
Quite true. Well, Dr. Souviron, I would shake hands with you. However, I'll pass on that. We did that earlier. We thank you so much for this interesting and exciting behind-the-scenes look at the work of a forensic dentist. And we thank you for joining us on this edition of Snapshot. Until next time, trying to get a deep breath, I'm your host, Alan Wolfe, reminding you, keep your focus right here on Snapshot, and we'll see you next time. Thanks again, Doctor.
You're welcome.